Hello, this is my health education project number 3. My name is emilystaley. I'm from Indiana State University in the RN to BSN program, and the PAR I chose to talk about today is women with gestational diabetes. Learning objectives. Upon completion of this presentation, the viewer will be able to list 5 risk factors for gestational diabetes, state 3 health issues gestational diabetes puts women at risk for, state 3 health issues gestational diabetes puts infants at risk for, explain 2 ways community nurses can promote health and educate about disease prevention at the individual and population level necessary to improve population health, wellness, and the promotion of healthy lifestyles for pregnant women and children. Identify 2 ways community nurses can uphold and justify ethical principles when using patient care technologies in a community setting in order to advocate for pregnant women and infants. Please stop now to take the pretest to assess your prior knowledge about gestational diabetes. The pretest can be accessed by clicking the link titled Pretest in the description of the YouTube video. Why are pregnant women with gestational diabetes and their infants an important population at risk? There's 2 populations at risk in this PAR, mother and baby. Gestational diabetes is easily preventable with the proper education and prenatal care. Gestational diabetes begins a cycle of unhealthy communities. Gestational diabetes is one of the most common pregnancy complications, with a prevalence between 2 to 25%. Gestational diabetes risk factors: maternity obesity, prior gestational diabetes, family history of diabetes, women who are older than 25, women who are African American, American Indian, Asian American, Hispanic, Latino, or a Pacific Islander, women with polycystic ovary syndrome, women who are pre-diabetic prior to pregnancy. Health issues pertaining to gestational diabetes. Issues for the mother are pregnancy-induced hypertension, increased incidence of cesarean delivery, higher risk of developing obesity, diabetes, and other metabolic disorders in the future, preeclampsia, prolonged labor, cardiovascular disease, breast, thyroid, stomach, and liver cancer. Health issues for the baby can be autism spectrum disorder, development of childhood metabolic disease, large for gestational age, rapid weight gain, childhood obesity, injuries during birth, hyperinsulinemia, hypoglycemia, and hyperbilirubinemia. And they will also have an increased risk of having gestational diabetes when they're pregnant, when they're older. How can we reduce these risk factors? We can do gestational diabetes screening during 24 to 28 weeks of gestation and then on a routine basis after that, including the fasting glucose level testing. Non-stress test, which is a test to monitor fetal heart rate acceleration in response to movement, or biophysical profiles, which is a composite of fetal variables such as tone, breathing, and movements into a scored system, biweekly between 32 to 34 weeks of gestation. We can help women get affordable access to prenatal care. We can educate women about modifiable lifestyle choices, including nutrition, counseling, and safe exercise education. And we can help them get access to insulin or pharmacotherapy if their diabetes is uncontrolled by lifestyle choices. How can we advocate health promotion and disease prevention at the individual and population level necessary to improve health and wellness for women and infants at risk for gestational diabetes? We can educate the population of risks and risk factors related to gestational diabetes by having a one-on-one nurse visit with the pregnant patient and partner if indicated to discuss signs, symptoms, risk factors, prevention methods, and lifestyle choices. This one-on-one visit can be incredibly important. It would be specifically for education only. Since gestational diabetes is so prevalent, it is necessary to have an entire teaching session on the topic in early pregnancy, prior to the second trimester, which is when they're more likely to get gestational diabetes. The patient should leave with an understanding of gestational diabetes and the importance of prenatal care regarding this disease. We can give the patient pamphlets, pictures, diagrams, anything tangible to take with them in order to continue their health promotion and disease prevention. While advocating for this PAR in a community setting, nurses must uphold and justify ethical principles alongside health promotion and disease prevention. How can we keep this important promise? As a pediatric nurse for 7 years, I learned how important it was to help families stay healthy. It can be so difficult to know the right decisions and even more difficult to continue to make those right choices. Their lives are so busy, full of appointments, school, work, extracurricular activities, and etc., that often health promotion and disease prevention can fall to the wayside. I make a promise to the families that I am here to remind them of what is important to do to keep everyone healthy. This includes pregnant mothers and infants. One way to advocate for this PAR specifically is to call every patient within their 24 to 28 week gestation and remind them to come for their glucose test. If they do not come to the appointment, reach out again and reschedule the appointment. Encourage compliance with this. Remind the patient why this is so important and what risk they are at if they do have gestational diabetes and it's not treated correctly. Thank you for watching the presentation. Please take the post-test to gauge how much you have learned about this population at risk. Click the link titled Post-test in the description below. I hope you learned a lot.